I think a few things resonated with me that I'll highlight. One, you mentioned that cancer is not a competition, and I think everyone who gets a cancer diagnosis has that sort of they see that everyone else is suffering more than them, so they should diminish what they're going through. So I think that resonates with me in particular. And then mindfulness, you mentioned you should practice it, and that's I agree completely. When I first heard of it, I was like, okay, I close my eyes and like all that comes up is the 20 things I need to get done by the end of the day. Because I never thought to slow my mind with mindfulness, but yeah, practice makes perfect, right? So
Absolutely. I will to add on to that. I was truly the same way when I started my master's program. I was hesitant to believe in the benefits of mindfulness. And then I got into the program and started looking at theoretical orientations and looking at the research and even neurobiological research of mindfulness and things, and realized I was wrong. And so now it's something that I use all the time with individuals I work with.
great. I'll invite Craig members to, you can turn your video off and get ready for a roundtable. Seth, I invite you to stay for a roundtable. I'm sure you have perspective too that would be very useful.
Sure.
I actually have a question for Seth.
Sure.
So for breathing exercises, so I kind of experience this, and I've talked to a couple of friends who have as well, where sometimes you get really focused on, I think your blood pressure increases a little when you breathe in. And I don't know if that's like the case, like how do you work around that?
Sure. So becoming focused on.
Like the blood pressure like goes up a little bit when you like breathe in, and then like you relax as you breathe out, but then it comes back up and you get like kind of focused and like a little panicky about that.
Sure. Yeah. A lot of the mindfulness exercises that I recommended, it again, that would be sort of one of those bodily sensations that I encourage people to, when they notice it, acknowledge it, sort of with curiosity, being, huh, that's interesting that my body is doing that, and trying to let it pass us on by, focusing back on the breath. Again, that's always easier said than done, right? It's not something that happens in one session. It's a matter of repeated tries. If it does bring about a sort of panic response in you, um, maybe there's different coping skills that might be better, or trying it for shorter periods of time to build up a tolerance. Certainly, the goal should never be to worsen your anxiety. Yeah, even physical sensations is part of that sort of acknowledging and moving back to the breath. But again, if it's causing too much anxiety, usually then I work with people to find other things that might be useful.
Thank you.
Yeah.
I'm a big supporter of the breathing methods. Even right before your doctor's appointment, even in the waiting room sometimes, because I know I'm going to get more anxious as I step in. And so I try to plan for that. And so I really appreciate your different methods of letting the thoughts go by like a passerby. I thought that was a great way to look at it.
Oh, thank you. And yeah, certainly, again, my belief is that this idea of clearing our mind is not realistic. And so it's about rolling with it. And again, I know that it helps train our brain then to, in anxious situations when we're not doing this exercise, it helps our brain to say, okay, let's take a step back and look at, why am I feeling this way? Why is this happening? And so it has less emotional weight on us.
Yeah,
Great.
I think that,
All right, go ahead.
sorry. I think that I've used kind of a combination. I start with the 5, 4, 3, 2, 1 just to distract myself from all of my thoughts, and then I can be a little bit better with the mindfulness. But the most important thing I think that I learned is that the distraction is okay, that your mind is supposed to wander, because I kept chastising myself for that, and knowing that it happens and it's normal was helpful for me.
Great. Well, bouncing off of something that Seth said, you should one of the first things to do is reach out for help. So the first topic is, how do you bring up your diagnosis with your family, friends, and support group? Because I think that itself brings anxiety and a lot of feelings. So I'll open it up the floor to our Craig members. Sue, you're muted.
Hello. I had mentioned that as I got my diagnosis and it sort of spread out because it's very hard for me to tell people. And then once that was, the hurdle was over with, then there was the anxiety of continuously people asking me, how are you? What are you doing? So I had a friend, and you can do this online. Their hospitals have caring pages and things like that. But I had a friend who was my communicator. So every week or so, she'd send out an email blast about how I was doing, very detailed. And that lifted a big burden because people were aware of what was going on. I didn't have to tell people over and over and over again. And so that helped me quite a bit.
Any other advice from our Craig members? Or from Seth? Oh, Sarah, go ahead.
I think it's okay for you to tell as much as you want to the person that you're talking to. There were some people that I let into my journey 100%, and they heard every detail. And there were other people that maybe I didn't trust as much. And so I may have left some information back or just sort of glossed over and given them just, the bullet points, not so many details. So I think it's really an individual decision, and you really have to just go based on your feelings, how much you want to share. And I think that that's perfectly fine and okay.
I like what Sarah's saying, because as I'm listening to her, I'm starting to think you have control over who knows what. So that is a good feeling. I'm kind of an emotional person, so I tend to go blah, tell everybody everything. But it does give you that sense of control because everybody doesn't need to know and doesn't want to know. So I love what you said, Sarah.
Yeah, thank you.
Great. And sorry, go ahead.
Sue, I really liked your recommendation about, like using I had a care pages when I was going through treatment.
Yes.
I'm not a native of Illinois, so my family's in a couple different states and friends from college. So it was really easy to have one platform to share that people could check or not check, if they wanted to know or didn't want to know. But it was more private than something like Facebook. So I think those tools are helpful because, again, you can share as much as you want, as often as you want, and just kind of leave it at that.
Kind of related to that, how did people go about bringing it up to work, to your colleagues as well as your boss, especially knowing that you're going to have to start asking for time off or different other things?
I can get started by just saying that I feel like my experience might have been a little unique because I was working in cancer research space. So I feel like everybody was very understanding of the journey that I may have to face. But I would say that you could definitely be prepared for all sorts of various reactions, because I was working with several people, still in the cancer space, but my one of the closest people I was working with had a very shocked reaction that was shocking to me as well. And so just kind of being prepared for navigating all of those situations. So just getting yourself mentally prepared before navigating those conversations. And I find it's just easier to just be like, here it is. This is the detail that you need to know. Here's what may be up and coming. One of my friends commented after she listened to me tell my dad and my brother about it, that she was like, I like that you just kept going and like just said the details, that like this was going to be the plan, you were going to be okay, and what like didn't really give them the opportunity to like get really shocked or ask too many questions ahead of what I was willing and able to share at that moment.
I think too, just as you were saying, having that kind of sort of brain dump with your boss or supervisor, I was very lucky. I didn't have any problems with what I needed to do, but and talk about it. I have to go to treatment every week or every month. I'm going to be out. This is going to happen. And to be, especially with your boss or supervisor, as honest as you can. And you can also get a feel about how they react to those things. It may be positive, it may not be as positive as you like, but at least there's a lot of honesty on the table and you can work with it.
How about the flip side of that? So for the people that are receiving this information from you, how are we supposed to act, or are there things that we shouldn't say, trigger words, etc.?
I have a funny one. There were a couple of shocked reactions I got that were hilarious, but one, and this may not be funny to certain folks, which I completely acknowledge, but you just try to take it the way that you can. But I had one person who was trying to just, share a story about somebody he knew who had recently also suffered a breast cancer diagnosis. But then the end of his story was, and then she died. And that was probably not the right thing to share. Like, so I appreciate the wanting to share a journey
Yes.
and whatever, but like, maybe pulling a positive out or potentially not sharing that journey at that particular moment in time, whatever that may be.
I think their intention to connect with you is probably, heartfelt, but yeah, should have stopped at the, and then she died.
I was gonna piggyback off that. I can't tell you how many times I hear survivors coming to me telling me about those very similar stories, and that's where I always use that quote again of the world is full of well-meaning people that just miss the mark completely. They are trying to connect, and you just sort of shake your head at why did you think that that was the appropriate story to tell? Certainly.
Yeah, I'm sure, well-intentioned, and they're probably going through shock as they kind of process what you've just told them too. So just verbal diarrhea, if you will. Christy, did you have more to say?
I was just going to bring up the fact that I appreciate this talk, and one of the names is that it's an unknown, because so many people, again, they post things, or they assume that you are going to be injured forever. And I think, again, like Sean said, it's well-meaning, and it's to be empathetic, to show empathy to people's situations, but at the same time, it seems like it's predictive of your demise in a way, and I don't really find that helpful. But I want to acknowledge that people are trying to show empathy at the same time, but sometimes they don't have the right language for our ears to hear.
Eric, Diane, she had her hand up.
Yeah, go for it.
Yes. Yes, hello. I have metastatic breast cancer, stage 4. Hi, Sarah. For me, I'm a mentor for a couple of cancer institutes. I've trained online, and one is Immerman Angels, and I have about 6 people that I contact every month and talk to them. And one of them always says, I like to keep it private. I don't tell people, but I think a lot of other people tell on her. But I am a real blubbermouth, to be honest with you. When I first got stage 3, before my recurrence, I was teaching at a high school, and I shared that with them, talked to the teachers and everything, and they had a Miss Sal Day for me, and they sold T-shirts and raised $2,000 for me. My students all came into the classroom and were grinning and wearing pink T-shirts with Miss Sal Day on it. So from then on, I decided that I was going to mentor and help as much as I can. We talked about educating people. I often read things about people getting angry about what some people say. I never take that attitude. I'm there, and then I will educate them then on metastatic breast cancer, because I do get a lot of ignorant comments at me. When are you getting off the medicine, etc. I mean, it's a chronic disease, and I will be forever on my medicine. So it's my opportunity to educate as much as possible. Can I take this moment to come to a different thing that hasn't come up, and that's goals. I made it to 5 years. I'm almost 73 years old, and I didn't know if I would make it to 5 years, because according to statistics, it's like 28%. But I mean, it's an individual disease, so you can't really go by that. But I am conflicted a great deal. After I got to the apex of 5 years, I now have to reset my goal, and I feel a need to do that. But I'm very conflicted because I just don't know how long I'm going to live, to be honest with you. So I just wondered how people deal with that, because I kept thinking maybe my grandson is 14, ninth grader. Maybe I could see him graduate, but I don't know if I'm really telling the truth to myself. So I don't know if you had an experience at that, or you think making a goal on how long you're going to make it through and then re-goal. Um, I don't know. It's just throwing in a new subject area, I think.
No, I think that's a great point, right? I think goal setting is probably a good idea, but offsetting that with kind of, I guess, reality and also survivor's guilt is wrapped into that as well, which we mentioned a little bit. But any members have advice on evolving goal setting?
So I will say, Diane, I appreciated you bringing that up, and I think it's different for everybody. But one point you said, and I say this to myself all the time and to others, you said, well, I don't know how long I'm going to live. Well, neither does anybody else. So I tell myself, I don't think about when I'm going to go, because I tell people all the time, we all have a date. We just don't know when that date is. And my date is not today, and I'm going to live every day just like that. And so I teach myself to think that way every day. When I wake up, I'm so grateful for another day, and I could be here till I'm 110. I don't know. But I've lost really good friends in the last year that had nothing to do with cancer. So I look at it very differently. I don't take my cancer diagnosis as I now have a limited time to live. Every day I look up and I say, thank you for another day, and let's make the most of it.
I think that's a great perspective, Vanessa. Anyone else have thoughts on that?
From a counseling perspective, sometimes when I'm working with individuals and they ask me something like that, I encourage, does that goal now look like not a set amount of time, but an experiential goal? I want to go do this. This is my goal. I want this to happen. I want the new floors in my house. I want to go see my grandkids again if they're out of state, that kind of thing. So experiential goals as opposed to strict just number of years goals or things like that.
Okay, thank you.
All right, moving on my topic list. Seth mentioned scanxiety. and sort of getting really anxious for doctor's appointments, and then what follows, right? Like waiting for your results can also be a really anxious period of time. Do members on the call or Seth have specific advice on how you deal with that?
I personally just find comfort in distractions. So waiting for results is always a big one for many people and many different times for various reasons. And so I personally like to throw myself into work. That's my personal distraction. But if there's like a hobby or something, just basically passing that time, because that time is going to pass no matter what, but it's just how you're going to feel and what you're going to do in that time period is what matters for you.
Yeah, I agree with Catherine. Distraction is the best for me. I have found that, if I'm sitting and I'm not doing anything, like the anxiety, I'll just feel it building up, even just going out and taking a walk. That's probably why I liked Seth's 5, 4, 3, 2, 1, because it takes a few minutes of distraction, and sometimes a few minutes is all it takes. But I also, throw myself into my work a lot, but when I run out of work, sometimes I need a hobby. And I like to be outside, so I'll go hiking. And when you're hiking, you've got to just take care of yourself and make sure you make it to the end of the trail or back to the car. So sometimes that's a distraction. And it's a very peaceful environment too. So I feel like that's worked well for me when I'm anxious about things. And it also keeps me away from checking my phone every 5 minutes because I leave my phone at home.
Yeah, I think that's great advice. So we've chatted about, so Seth had a couple coping strategies. Now we've mentioned a few others like going hiking. What are other coping strategies that people use or have found helpful?
Well, I think for me personally, things that make me very happy are being around children, and not in a weird way, but even things like on Facebook, they have those little reels with babies on them and dogs. And I look at those every morning before I get out of bed. And I'm not doing it now, but I did have a volunteer job at Carl where I would hold premature babies. And it's a wonderful volunteer program. It's hard to get into. I'm so sorry I had to let it go. But that's what I like. I just love being around children and their fascination and their delight. And whether it's watching a little video or actually participating, it really puts me outside. And all I think about is how wonderful it would be to be a kid again, but also the wonder that they have. And everything is so exciting the first time. I mean, I'm really happy now just talking about it. So that's one thing for me, and I'm sure everybody has something like that for them, I hope.
Vanessa, I think last time we chatted, you had something as well that you got into.
Yes. So after I got diagnosed, I have kind of always been very high energy, and I decided I needed to have some kind of relaxation technique. So I became a certified yoga instructor, and I teach yoga class. And back to Seth talking about meditation, we start every yoga session with deep breathing and all of that, and grounding ourselves. And that has really helped me kind of balance that as one aspect. And it keeps me, and it's a continual practice, so it keeps me doing that. And I found myself, I didn't even know I was doing it, but when I get into anxiety ridden situations, the deep breathing just starts naturally for me now, which has been very helpful.
Eric, do you see the question in the chat?
Oh,
or in the Q&A?
All right. So the question is, as a young breast cancer patient or survivor, I think my generation is often left out of the norm. I feel like young breast cancer patients often hit treatment hard, and everyone is quick to find a cure because those men and women are in their childbearing years. So how do you preserve that for them? And then for those older patients, they've already gone through menopause and maybe don't have the sort of family planning on their mind anymore. So how do you help women who are young or in the middle and in limbo navigate through kind of the perimenopause, especially for breast cancer patients who are put on hormone therapy? So I think we have someone online that maybe be able to really speak to that.
Yes, I can. So I'm also a young breast cancer survivor, and it is very difficult. They definitely, so mine was triple positive. They shut my ovaries down to go through treatment. Was given an option. I spoke with a reproductive endocrinologist to discuss reproduction preservation. There is something called I think it's the Young Cancer Consortium that offers a service where they help women to pay for and preserve eggs. In my case, that would have been a massive hormonal treatment with a hormone positive tumor that was growing very rapidly. So I felt that that was not going to be an option for me. And as far as I'm not sure if the question is more focused on that reproductive aspect. For me, I've decided that I'm okay with the fact that I would not have my own biological children for a variety of reasons. I don't know if reproduction is preserved or not, but for me, I just don't know if there's a genetic component that we haven't identified yet, but it is a very difficult situation. But reaching out to there are other young cancer survivor networks, also specifically for breast cancer as well, that do have a lot of these discussion topics on board. And I would suggest reaching out to them, which names I don't have off the top of my head for those specific for breast cancer, but there is one I am a part of that's for all different cancers called Stupid Cancer. And Crystal knows of that one as well. They're a wonderful organization for adolescent and young adult cancers, and they have a variety of resources available as well.
Yeah, I'll second that because I think, I was also a young adult when I was diagnosed with leukemia, and it's very isolating because there's just not very many people out there like you, in your age group. So I really think that organization is great because you can connect with other people your age who have been there. So it's really helpful.
Yeah, I'll say too that so not even cancer diagnosis, but also people who are testing positive for genetic indications for cancer, like the BRCA1 genes. And then if you come back positive for a mutation, you have to make a decision whether to have a mastectomy or hysterectomy. And that, if you're a young woman, is a very difficult decision. And I know that there's plenty of counseling resources out there, peer support groups to help you kind of work through your own thought process on that. And then from a researcher's perspective, we're recognizing more and more that we have to deal with people who are diagnosed with cancer at a younger age differently. And that comes both in terms of treatment, our mental health paradigm, and also just how the whole health network deals with younger people rather than older people. So far, we've kind of lumped everyone other than maybe childhood leukemia into the same box. And we're starting to appreciate that that's maybe not the best strategy. Okay, any other questions? We are finishing our hour-long session. There's plenty more material, I'm sure. I'll just remind everyone that this session has been recorded. It will be posted. We also have on our website posting from our last survivorship webinar, which was on navigating the healthcare system and health insurance system. So you can go and check that out. And we're an active group. Cancer Research Advocacy Group is actively starting to plan our next webinar. And if you have suggestions for what you'd like to see content-wise, please send us an email or go onto our website. I'm pretty sure one of our emails is on there. Or you can just Google University of Illinois, Eric Nelson, and you'll be able to find my email. Because we're always open to suggestions and trying to meet the community needs. I'd like to thank Seth again for coming. Your work is really, really important, and we appreciate you taking the time on a Saturday morning to share some perspectives on mental health care. And thank you, Jessica. In the chat is my email. All right, and of course, thanks to the Cancer Research Advocacy Group, the Cancer Center at Illinois, and Illinois Cancer Care for co-sponsoring this event. And we'll see everyone next time.